Thank you, Mark. Evening, everyone. Welcome to the Mayor and Council meeting of January 26, 2021. And we'll start the meeting with the statement on the notice of the meeting. Madam Deputy Clerk.
Okay, adequate notice as well as electronic notice of this meeting were provided in accordance with the requirements of the Open Public Records Act and state regulations governing remote public meetings. The notice included the time, date, and location of the meeting and clear and concise instructions for accessing the meeting via computer, smart device, or telephone. The agenda and all related documents and other materials were posted electronically on Princeton's meeting portal and made available for download at least 48 hours prior to the meeting.
Thank you. Could we have the roll call, please?
Sure. Ms. Perone-Lambros?
Sorry, here.
Ms. Niedergang?
Here.
Mr. Cohen?
Here.
Ms. Fraga?
Here.
Mr. Williamson?
Here.
Ms. Sachs?
Here.
Mayor Frida?
Here. Thank you. First up on the agenda is the approval of the December 22nd, 2020 community recognition. Is there a motion to approve those minutes as posted? Leticia?
I just wanted to move.
Okay, thank
that
you.
they-
Eve?
I'll second,
Thank you.
please.
Eve is good second. All in favor, please say aye.
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 Okay, that's unanimous. Next, we have announcements and reports. Michelle, you actually have an item listed here. Do you want to start?
Oh, okay. Sure. I have my regular reports as well as that. So I'll start with the Economic Development Committee. I just want to report that we've formed a subcommittee to look at expanding what the allowable uses are. So we're looking at ways that we can change zoning to allow for more experiential types of uses, such as music, entertainment, exercise establishments, and so on. With the growing number, unfortunately, of the vacancies that are occurring, one of the goals is to find ways to change zoning to allow these uses and also look at how to remove parking requirements for change of use situations. So I wanted to update on that. I also will update on the Planning and Redevelopment Committee. We are going to recommend, we're looking at recommending a professional services contract to explore development of 400 Witherspoon Street site with the goal in mind of combining our staff offices that are currently located at Monument Hall, relocating the Department of Works that's located on John Street, and bringing our staff together in what would ideally be situated as a combined facility. So we'll be working with our staff to identify a professional service contract that can analyze our space requirements and create a plan and timeline for getting this done. And then lastly, I'll report on the Shade Tree Committee, which I just came from that commission meeting. And one of the many goals this year, but the top priority that the Shade Tree Commission is looking at is on getting a tree inventory done. This is something that they've talked about for several years. Tree inventory will help us warn off potential tree failures and look at pests and diseases and the such. So those are kind of some updates on committees and boards and commissions. Thank you.
Thank you. Eve?
Before I go with my reports, Michelle, can I, because I think part of the impetus of your redevelopment report was to give the Senior Resource Center some information about what their timeline might be at Suzanne Patterson. I know Drew Dyson, who's the ED there, is in the audience. So I wonder if you have some information for him in terms of what the timeline might be for PSRC to remain at Suzanne Patterson.
Well, I know that he needs to get some clarity. So we are going to have a meeting this week with staff. We are making it a priority. I don't have a timeline yet, but we are part of what we want to accomplish is to create a timeline and a set of goals. So that's really it's critical for them, and it's critical for the Department of Public Works as well. We really need to move forward on those plans because I don't want to keep putting that on hold.
Okay,
So,
excellent. Thank you for making that a priority. Mayor, should I continue with my
Please do.
report? So I just have a single item that I wanted to bring up to discuss with my colleagues, which is to create an efficient way of dealing with constituent mail that requires the activation of staff. I mean, very often we get mail, for example, today, for some reason, I've been getting a lot of emails about bicycle safety and bikeways. Can't imagine why, but anyway, so that's something where that's really my own personal opinion. I don't need to ask staff to do anything, and those I can respond to on my own. But when an email comes in, as it did over the weekend, about a noise complaint, several, since the person chose not to email all of us, I think nobody knew who else had gotten the email, and several people started to take steps to respond to the complaint, which is great, but incredibly inefficient. So in discussions, one of the suggestions that was made by our attorney was to have any constituent request that involves having staff go out and check something or do something or take some action should get sent to the administrator to be in touch with the appropriate staff, and the mayor is kind of a centralized spot to keep all of this. And so I wanted to get everyone's feedback on this so that we can continue to be, and then it could come back to a council member for a response, or to the mayor, or whatever. We can figure that out. But the key thing, I think, is to make sure that issues are responded to appropriately, but that several council people don't take this on individually, and not a wise expenditure of time. So I want to hear what the rest of you have to say about that.
David.
Yeah, I think that is a good idea. I think the way to break things down when possible is not just to think about when there's a request for staff activity, but when it's a question of policy. If we already have policy in place that should be addressing the issue, then council should not have to be involved. And referral to the mayor and to the administrator is very straightforward. When there's a question of whether we have a policy, the correct policy in place, it's good to involve a member of council or more who might have responsibility for studying and making recommendations on those kinds of policy changes. So I just wanted to add that as another factor to consider in how to steer these inquiries.
I mean, Eve's central, I'm sorry, Mayor.
Go ahead, Dwayne.
I was going to say Eve's central question, though, is about when staff gets involved. So I'm thinking if you're dealing with employees who are paid to do certain jobs, it would only make sense if we send it to the municipal administrator. So to Mark DeShield's office, I would CC Mayor Frieda so he's in the loop. But since Mark has that type of direct, I consider one of Mark being the municipal administrator, I would consider one of his jobs is to be, he directs which member of staff or members of staff have to do certain functions. So he should be sort of like the gatekeeper in doing so. And I would add, I guess just a little bit more of what David said, is that I would think that if it's a question that sort of touches on a BCC, maybe just figure out which one of us is the liaison to that BCC, and maybe send it to the other person and see if they want to take a stab at it, so to speak, But yeah, but I guess that would just be a judgment call.
Yeah, I would just say that I like the idea of it going to the two Marks, myself and the other Mark. And I think just on an informational basis, because as what happened this weekend, we did not know that it was sent to several individuals because it wasn't addressed that way. So I think one of the things that we could do on our end is just send out an informational email to people on council if it's the type of thing that needs to go back to council, just saying we have this and it's being looked into. just so people don't, not everybody's, running around on the same thing. And it might save some of you from sending an email to the two marks and just knowing that it's already being handled. And David, I heard your remarks about policy versus something the staff needs to do. And I think that's all very easy for us to handle and keep everybody advised as to what's going on. Eve.
So just to close that out, thank you. I appreciate that. I really think that this will help and will ensure that, an issue gets addressed without having 4 or 5 council people trying to contact the administrator the administrator may still get several emails from all of us because, as I said, we often, and as Mark just said, we often don't know, like, did that email come just to me or did it come individually addressed to all of us? So he may get 6 emails saying, hey, this came in over the weekend, but that seems fine. And then if the marks can follow up and let us know what the result of those inquiries, as was done with the noise complaint over the weekend, that would be terrific, because then we know the loop has been closed and I kind of keep a mental checklist. And once I know it's been taken care of, then I push it off to the side. So anyway, that's great. Thank you all. And that's my report for tonight.
Okay, thank you. Other council, Leticia.
Yes. So this is something that I wouldn't normally report on. But I thought it important, as all of you know, this year was the beginning of the year was reorganization meeting for the first meeting of the year for all of our boards, commissions, and committees. And normally it's not something that I would report on, but I felt it important to announce because, especially for many of my boards, commissions, and committees that I'm liaison, they work so closely with the public, whether it's collaborating on initiatives or co-sponsoring events and projects. I thought it important for everyone in the community to know that we have new leadership on some of our BCCs, starting with our Board of Health. There's a new chair, Dr. Meredith Hodak Avalos, and happy to report that Dr. George DiFernando is also staying on as vice chair to provide support, especially during such a critical time during COVID. So both of them will be working closely together, but Dr. Hodak Avalos will be taking the leadership role this year. In the Human Services Commission, we have a new chair is Veronica Olivares, and the vice chair is Larry Spruill, both well-known members of our community, and they will be also working closely together to move forward initiatives and to lead the commission. Tonight, Civil Rights Commission had their meeting, and they again elected Tommy Parker to lead that commission. But we have a new vice chair, Sherrod Smith, who's a graduate student from the university, is going to be the new vice chair, and recording secretary is Nick DiDomicio. I think it's really wonderful when we recognize that we need to encourage members to take on leadership roles, but most importantly to work together for the benefit of the community. So I think everybody on each of these commissions and boards is excited for the new year to hit reset and improve on the work that's been done before. Thank you.
Thank you. Other council reports or announcements? David.
I just want to mention briefly the Pedestrian and Bicycle Advisory Committee, which we will be hearing from a little bit later this evening. They have a memo in response to the Hamilton-Wiggins, Paul Robeson corridor study report. But I also wanted to mention that they're working diligently on getting a resolution together for the formation of a Vision Zero task force. And that would be to further study the topic that was presented to council a month or two ago the goal being to reduce fatalities and serious accidents, serious crashes to zero in our town. And for the Flood and Stormwater Committee, we have two new initiatives underway, one of which is to, we have a subcommittee working on language for a stormwater redevelopment ordinance, which would impose stormwater redevelopment, stormwater management requirements, not just on new construction projects, but also on projects that are redeveloping existing sites. And the second initiative is to study the applicability of a stormwater utility to Princeton and a process to bring that about if the study determines that it is applicable to our needs for managing stormwater in Princeton. And for those in the audience who don't know what a stormwater utility is, it's basically a body that is funded by essentially user fees, which are based on, which are paid by property owners based on how much stormwater flows off of their property, rather than just the size of their property, the way property taxes are determined. So that's the way that it's funded. And the goal of the stormwater utility is to put in place infrastructure that will be adequate to the needs of managing stormwater in our community going forward. People know with climate change, the Northeast has been most impacted by dramatic increases in the severity of rainstorm events. And so when you have a severe rainstorm event, it really stresses the stormwater management infrastructure. We have a lot of improvements we need to make, and a stormwater utility would be one way of accomplishing that. So we're studying that.
Thank you, Dave. Are there other council announcements or reports? All right, seeing none. Staff reports. Deanna?
Thank you, Mayor. I have just 3 short reports to provide about municipal construction projects that are beginning soon. The first project is the Bank Street Improvement Project is finally advancing to construction. On Thursday, January 28th at 7:00 p.m. we will be holding a virtual pre-construction meeting with the neighbors and the municipal contractor. The public is invited to attend and ask questions. More information on this meeting is available on the municipal website. Construction will begin on Monday, February 1st, weather permitting, and will extend until July. We've been working diligently to find parking solutions for the property owners and the residents on Bank Street as they will be relocated and unable to drive through the work zone while work is taking place. So we'll go into many more details about that at the public meeting on Thursday night. Second project is a design project currently. Engineering and Recreation are collaborating on the design of a new synthetic turf field lighting, and additional parking at Hilltop Park. We anticipate conducting a public meeting on the project in February, and then presenting the project to the planning board in March. The goal is to have this project also under construction this summer or fall. And then the last update is regarding the Witherspoon Street project. Yesterday, engineering and planning staff made a presentation to the Historic Preservation Commission regarding the design of the Witherspoon Street project, as well as some of the materials that will be incorporated into the design. And we request an opportunity to attend an upcoming council meeting to provide an update to council as well. And if possible, we'd like to come sometime in February, one of the council meetings in February. So that's my report. Thank you.
Thank you. Do we have other staff reports? Jeff?
Thank you, Mayor. I just wanted to update Mayor and Council. Last week, we ran a successful COVID-19 vaccine clinic in collaboration with Princeton University for healthcare providers in the Princeton area, as well as healthcare providers on Princeton University campus. And for some individuals, as we've started to get into our 1B population, which includes individuals over the age of 65 and those with pre-existing medical conditions. We are working in collaboration with Mercer County Community College and Mercer County on the establishment of the County Community College site, which is going to get up and running this Thursday and Friday. I know there's been a lot of discussion about vaccine shortages, and Princeton locally continues to request anywhere from 500 to 1,000 vaccines per week, which we feel like we're capable of administering. And we're going to try to allocate those to the individuals on our existing wait list, with obviously prioritization going to those individuals that are currently eligible. In the meantime, what we're doing is working with the other local community sites that are set up. So we do have a number of 1B individuals that are on our wait list going to the Mercer County Community College site. And then next week, they will be going to either Hopewell or Lawrence Township for their community sites, and we'll continue to set those sites up as we go. So as more vaccine news comes out, I'll do my best to continue to update everybody. But at this point, we continue to ask for 500 to 1,000 doses, and then continue to ask for collaboration with the county as we hope that they receive more doses for their larger sites as well.
Thank you, Jeff. David, you have a question?
Yeah, I just was curious, Jeff, if you could tell us what category do teachers fall into? Public school teachers?
Great question. Actually, I was just speaking to Princeton Public School District about this today. So the teachers that fall into the 65 and older, and then those with pre-existing conditions, fall into the eligible criteria of the 1B category. Teachers in general, as an industry, have not been moved up like police and fire were about 2 Wednesdays ago when they were moved into the 1A category. So we're keeping our eye on that news, but we did ask the Princeton Public School District for a list of the individuals that meet that criteria, because what we'll do is we'll try to work them into community clinics, and we'll also advise them on the best way for some of their teachers to find locations to get shots. They do have a number of staff at this point that have been vaccinated from what we've been told. And from the news that we've heard this week so far, there are a number of Princeton residents that were able to get over to Penn Princeton that did start releasing some of their vaccine for the public use for the open pod.
Eve?
Thanks, Jeff, as always, for all your hard work and the little sleep that you've gotten over the past year. I just want to follow up on one thing that you said. You mentioned that you were requesting 500 to 1,000 doses a week. I'm just curious what you are actually receiving, if that's what you're.
So again, at this point, Mercer County as a whole, last week they received 800. This week they have 800. However, there was 200 from an additional stockpile, so they'll be distributing 1,000 through community sites. Now, remember, this doesn't include the medical sites like Capitol and some of the other closed pods that are existing. So these are just the public health departments. We've received to date 800 vaccinations for first doses at the Princeton Health Department. All 800 have been accounted for, with the exception of 20 that were left over from the university site that we're working on allocating right now. We're going to get those out the door this week, but all 780 have been inputted into the state immunization system. And then we actually just received today our 500 doses for our second dose clinic, which is going to be taking place on February 10th.
Sorry, just a follow-up. When you say university, I think you were using Carl Field's house as a site, but that was not university run.
No, correct. That was actually municipality run.
Okay.
So in a collaborative effort, the university hadn't run a vaccine clinic. They didn't know in terms of how the management of the vaccine went. So we had offered up to them. They had a number of healthcare workers on site that were 1A. We wanted to make sure they were vaccinated with both faculty and students coming back. And then we felt like it was a good opportunity to also leverage their staff to assist us with staffing the vaccination clinic, because it takes upwards of 15 to 20 people. Plus they offer the facility. So it was just a really nice partnership that worked out. So out of the 230 individuals that were vaccinated, 130 were actually specific to Princeton as the town, with healthcare workers and then residents.
Okay, thank you very much.
You're welcome.
Leticia?
Yes, thank you, Mayor. Thank you, Jeff. So I have a question. It did come up at the Human Services Commission meeting as far as, because I did share information about getting on the wait list and different ways that one can sign up, including, recommending that they sign up in the state, local level. The question came up as to whether this is available in multiple languages, and if for those that are not computer literate, whether there's assistance available to help individuals get on that wait list. I don't know if it's something that the outreach coordinator perhaps is already working on, but that question did come up, and I hope we can provide that information to the public.
Thank you for bringing that up. Our Vulnerable Population Outreach Coordinator, which is the 2-year grant funded position through the Department of Health, actually just started today. That's one of her first tasks, is to go through anything that we have existing for the vaccine clinics and making sure that it's in the languages that it needs to be in. So she's working on that right now. The other item that you brought up is a really good point in terms of making sure that individuals have access to this, not only on, especially like the website, but then also with other forms of media that we're putting out there, just making sure that individuals have access to that, and making sure that people like Human Services have enough information regarding the vaccine rollout as well. So when they speak to people through their social services, they can also provide that information. So yeah, thank you for bringing that up.
Yes, thank you. And actually a follow-up question, it also came up today. At one point in time, you had mentioned that there was a site available for individuals who needed to be tested, where they could get tested for free. Is that still available, and where would that be?
So Sante Pharmacy on Nassau Street is still a FEMA site, and individuals can get tested for free there on Tuesdays and Thursdays when it's open for those individuals. If other individuals have questions about testing, and or if it's, for instance, a situation where you might have more than one person or a group of people, we do ask just to contact the health department, because we can try to coordinate testing as a whole. So we can try to keep it as simple as possible.
Great. Thank you very much. Very useful information.
You're welcome. Thank you.
Mia?
Jeff, I'm so glad to hear that Princeton is working to help the teachers get vaccinated. I just am baffled, and it says so much about our society that they're not in the 1A category. But whatever we can do to help to prioritize the teachers getting their vaccinations, just let us know. And the other thing, I wanted to welcome Joe Small to our meeting and say, Joe, I'm so glad that you were able to log in tonight. And I know you've had some concerns about the vaccine information, and I'm so glad you were able tonight to actually hear Jeff directly. And if you have any questions, raise your virtual hand and Jeff will answer them.
And Councilwoman Sachs, I just want to let you know as well. So on our wait list, we were able to stratify the different industries that people were coming from. Number one were retirees, and number two was education field. So we do know there's a great interest from individuals that are teachers or working in education that want the vaccine. So we are, standing by and ready for whenever that happens. And I hope when that decision's made to, push that field into the eligible criteria, a lot of vaccine comes with it, so we can make it as easy as possible.
Great. Fantastic.
Okay. Mark, I think we have two people from the public that might have questions for Jeff. Can we let them in one at a time?
Is that me?
Joe, you're up.
Jeff has answered all the questions I had, so thank you very much. It's made it very clear. what
Okay,
happened.
good. Thank you.
Thanks,
We
sir.
should make more vaccine.
Okay.
Can you hear me?
Yes, Veronica.
Hi, thank you, Leticia. I think Leticia answered, I asked most of my questions, but I wanted to also ask related to people who are working in education. You mentioned the Princeton Public Schools, but also one of the questions will be, we have all these daycares, right? Like we have all the private, and then we have the Princeton Nursery. So we have all these people who are working in daycares. And in addition to that, we have the YMCA, the YWCA, who work constantly with the Princeton Public Schools for after school programs, but also the PYA, right? And we have like nonprofit like the Arts Council, who we have our teachers working constantly with children, right? So in order for us to continue, for me will be more like, what is going to happen? Are they, part of that part where you are covering educators? Or they're not because they're not part of the district?
So if they're eligible based upon their age and or pre-existing condition, we are absolutely covering them. The industry as a whole in terms of education has not been pushed into the eligible criteria as an occupational background that's eligible for the vaccine at this point. That being said,
Okay.
we are hearing a lot of concerns from the groups that you just mentioned in terms of when and how logistically they can try to vaccinate their staff. It's something we are, trying to stay on top of as best as possible, because I totally agree. Those faculty, those staff that are working with the students, they are exposed every day, especially the ones that are not on a hybrid schedule. Some are back 5, 7 days a week. So those are definitely on our radar in terms of trying to stay on top of. We are trying to work them into our local clinics as they fit the criteria. But again, at this point, we're really trying to work through the individuals that are eligible at this current point. And those individuals that are most vulnerable right now are those individuals that are 70s, 80s, and then with a lot of pre-existing conditions. So we're trying to get the vaccine out to them as quickly as possible. But by no means am I taking away anything from people working with children right now and then our community centers, because those people are exposed every day as well.
Okay. But just to clarify, so when you get to that point with educators, they don't particularly have to be working for the district, for Princeton Public Schools, right?
No, they can be working for a private school, community center. You got it. Yeah. And we're speaking to a lot of those private schools and nursery schools right now.
Okay. And then one more question related to what Leticia asked. So the people, because we have had these issues in the community, so people who are going to pay private testing sites because suddenly somebody came positive in one of the restaurants and they need to go test themselves, and they're charging them like $175 to each person. So I have no idea that there was this free, the place that you have with FEMA, I think Leticia mentioned to me, the drugstore on Nassau Street. And how can the people find out that information? Mostly like or more vulnerable community who who are struggling right now in terms of finding a place to go do the testing for free. And also, I heard that you do have a grant for the people who are not they don't have insurance, right?
Correct. Yeah. So fortunately, part of our vulnerable population outreach coordinator grant, there is a testing component to that we can help assist with some of the testing costs. That said, on princetoncovid.org, there are a lot of testing resources in terms of what's available, what's in the area. But if there's ever a question about individuals paying for tests, especially upwards of $150 and $175, I'm not saying that that's super, super high. Sometimes when they expedite the tests, it does cost more. But if there's ever a question over cost of a test, I do ask, please call me or email the health department, because we will work with you. There are a number of FEMA sites in the area and they're absolutely free. And there are businesses in the area that have utilized those services to test a lot of their employees at once. So I don't want any Princeton resident to put out money if they don't need to. So please contact us if that's a problem, but there are resources available on the princetoncovid.org website.
Okay, thank you.
You're welcome.
Thank you, Jeff.
Thank you, Mayor.
Thank you. Are there any other staff reports? Okay, hearing none. The next item on the agenda, we have a presentation on the Paul Robeson Place, Wigan Street, Hamilton Avenue multimodal corridor study final report presented by WSP USA for acceptance. Deanna, are you kicking us off?
Yes, I will start it off. Thank you, Mayor. With us tonight is Debbie Hartman. She's a professional engineer and planner with the consulting firm WSP. I'm going to give a little bit of an introduction, and then Debbie will give a presentation overview of the study data as well as the recommendations. So for background, in August 2018, Princeton Council hired WSP to complete a planning and engineering study of the corridor as a follow-up to the beta bike lane experiment that was implemented in May and June of 2018. The study goal is to produce a context-sensitive, long-term vision for the corridor that can be implemented through capital improvement infrastructure improvement projects in the near and long term. The services included in the original proposal were data collection and inventory, existing conditions assessment, community involvement, and conceptual improvements and implementation matrix. A variety of alternatives were proposed, and those included the installation of bike lanes, intersection changes, traffic calming, and pedestrian crossing improvements. The potential impacts of these alternatives have been identified, and impacts to on-street parking, mitigations, and offsets are also were under consideration. In this original proposal, the final report was actually just a PowerPoint presentation. So we fast forward to August 2019, so a year after the study was implemented or was begun. The draft corridor findings and recommendations were reviewed at a special meeting of the Bike Advisory Committee in advance of moving to a council presentation in October. The committee and the meeting attendees provided an extensive list of comments, and the Bike Advisory Committee abstained from providing a recommendation to council on the draft document. There was further requests for reviewing additional bicycle accommodations in it over and above what was included in the original study. And those two alternatives were bidirectional on-road facility with a buffered area as well as a shared side path. So in February 2020, Council approved a second supplemental professional service agreement with WSP to finalize the report, create a final report document, but also to assess the right-of-way impacts and the configuration of the roadway to accommodate a shared use side path or bike lanes. They also reviewed, responded, and incorporated comments that had been received on the draft document, and then also looked at providing an estimate of reduction of speed and volume in the corridor based on the intersection improvements that were proposed. So for those of you that are attending the meeting, the report provided by WSP begins on page 62 of the agenda. And with that, I will turn it over to Debbie to share her screen and review their report. Thank you.
Thanks, Deanna. You can see my screen?
Yes.
Great, thank you. Okay, Good evening, everyone. As Deanna said, the purpose of this study, which went from Route 206 all the way over to Harrison Street, it crosses an area that serves the downtown with parking and several schools in the area. And we were looking to provide recommendations that consider the users, all types of road users, including the high number of pedestrians and cyclists, as well as the motorists in the area. We wanted to consider complete streets and ADA compliance, and connections and linkages were also considered in the study. We did engage the local stakeholders, as Deanna said. We collected data on the corridor's existing conditions, and we used those to formulate our recommendations. So I'm just going to go right into the existing conditions that we collected. The first thing we wanted to do was to confirm the existing roadway widths, because that would dictate to some extent the changes that would need to be made to accommodate some of the recommendations we are giving. The width varies along the corridor. This section of Paul Robeson Place varies from 29 to 41 feet. We also measured the cross streets that cross the corridor. Chambers Street varies from 24 feet to 30 feet, and Witherspoon Street varies from 37 to 40 feet. Moving a little eastward, the section of Wiggins Street varies in width from 29 to 31 feet, and the side streets that cross there vary from 22 feet all the way to 29 feet. So there's significant variety in widths. And then the Hamilton Avenue section, that itself is consistent at 30 feet for the entire segment. Harrison Street varies for 34 to 39 feet, and the other side streets vary from 24 to 29 feet. Next, we collected data on crashes in the area, and we wanted to look at where crashes were happening more frequently. And we developed what we call kind of a crash hotspot map. There's definitely a large number of crashes in the Van Deventer Avenue section. And we also looked at the crash types to see if there were any overrepresentation of certain types of crashes in any particular area. And we did see an overrepresentation of right angle crashes in the area compared to other municipal statewide roadway averages. 7% of the crashes included pedestrians and 3% involved cyclists, which is also over the statewide municipal road average. We collected a lot of information for volumes and speed. We looked at, collected data through two main sources. We laid out ATRs, which are automatic traffic recorders, at 4 locations, and we also collected turning movement counts at 6 locations. We also collected one of those ATR locations was on Witherspoon Street itself. These are the results here listed in the table. AADT is the average annual daily traffic. So you can see the volumes varied from about 6,500 vehicles to over 11,000 vehicles. And the middle of the corridor, the central portion, has the highest volumes. We saw peak hours were generally between 9 and 10 a.m. and 5 to 7 p.m. And we saw a high number of turns coming in and out of most of the side streets, particularly at Van Deventer Avenue. The traffic counts were collected in November of 2018. And in that same year, DVRPC provided bicycle and pedestrian counts that were also conducted in November of that year. And their numbers gave us approximately 900 pedestrians walking the corridor daily and around 50 bicyclists in both directions. For speeds, we can see that the highest speeds are on the eastern portion of the corridor. Middle speeds were at the western portion, and the lowest speeds were in that central portion that was the most heavily trafficked from a volume standpoint. Next, I want to talk about the bicycle level of stress, which we call LTS. And LTS is a measure of traffic stress on a biker based on factors such as roadway widths, the volumes that are out there, and the speeds. And these are rated on a scale of 1 to 4, with LTS 1 being the most comfortable and most accessible for all users. And you can see some of the little pictures that we have there of, the child in the level of stress 1. And then it goes all the way up to LTS 4, which is tolerated really or comfortable for only the most experienced riders, your road warriors that are out there. And overall, the goal of the study was to accommodate an LTS 1 to provide that lowest level of stress so that all users could be accommodated in the corridor. So using those factors, the speed, the width, and the volume, we categorized each segment of the corridor using all that data that we had collected. And you can see here that the western portion where Paul Robeson Place is that dark LTS 4. The purple color is the most difficult or least comfortable for riders. And the rest of the corridor, it was LTS 3. So a little bit more comfortable, but still not where we want to be for the goal. Crashes and the widths and the LTS were the main influencers for the recommendations that we made going forward. The parking inventory is also important and is in our report and recommendations, but it wasn't the primary driver for influencing our recommendations. So I'm just going to walk through each segment to explain what the constraints that we saw at each of those sections. So I'm going to start over in the western section between US 206 and Chamber Street. We are existing LTS 4, so that most difficult and challenging experience. That area has a 29-foot curb-to-curb width, and it experiences a crash rate of 14.4 crashes per million vehicle miles. And the way those numbers are calculated, consider the volume and the segment length of that particular section of roadway and the number of crashes. And it's compared to similar roadway cross sections for the statewide average. So the statewide average for a similar cross section is 4.17 crashes per million vehicle miles, and this segment is actually rates as at 14.4. So, more than 3 times higher than the statewide average. There's no sidewalk on the eastbound side in this segment, and we have a high-speed right turn, a channelized right turn lane from northbound Chamber Street onto Paul Robeson Place, and that, creates cars entering at a high rate of speed onto Paul Robeson Place. And the 85th percentile speeds here are 35 miles an hour, and that equates to about 85% of traffic is flowing at a good pace up to 30 miles an hour. And there's insufficient space for dedicated on-road bicycle lanes. Next, we move over between Chamber Street to Witherspoon Street, and now we've moved into that LTS category of 3. It's much wider here. It's 41 feet curb to curb with parking on both sides. The 85th percentile speed is again 30 miles an hour. Limited or no space for sidewalk expansion, and here there's a heavy pedestrian volume at the intersection with the proximity of the schools, and there are left turn lanes present in that location. Between Witherspoon and Moore Street, we're staying within the LTS 3. The curb to curb width varies from 29 to 30 feet, and here's where we have the highest section of volume, over 11,000 AADT daily traffic. Our crash rate here is slightly elevated. It ranges between 5.4 and 9.6 crashes per million vehicle miles, and has insufficient space for dedicated on-road facilities for bicycles, and left turn lanes are also present. Moving along between Moore Street and Linden Lane, LTS 3 again, a little bit wider here from 30 to 31 feet curb to curb roadbed. 85th percentile here is a little challenging at 32 miles an hour. And there is insufficient space again for dedicated on-road bicycle lanes. And there is a pedestrian traffic at the intersection at Walnut Lane. And then finally, between Linden Lane to Harrison Street, again, LTS 3, a 30-foot curb to curb with the high 32 mile an hour, 85th percentile speed. Again, another high crash rate area of 12.9 per million vehicle miles instead of as compared to the 4.17 statewide average, and an insufficient space for dedicated on-road bike facilities. So taking that information, we started to develop corridor recommendations, and a lot of it considers traffic calming and implementing both horizontal and vertical measures to bring down speeds and possibly to bring down traffic volumes. One of the things that we looked at was parking. Again, not a main driver, but an important user also in the corridor. So by shifting parking from the from the eastbound side to the westbound side, we are able to add 29 parking spaces if that's something that Princeton wants to accomplish. One of the other things that we recommended in the study is to conduct a street lighting study, again, to emphasize safety and make it more safe for all the users, particularly the pedestrians and the vulnerable bike users. And finally, we also recommended that the town consider modifications to the zoning ordinances for T-shaped private driveways to simplify how cars approach from their driveways into the roadbed. And just a simple schematic of what I mean here, and disregard any of these measurements. That just grabbed a quick example, but currently car backs out of its driveway to turn around, and it makes it difficult, looking backwards to see conflict area with either another motorist or a bicycle or a pedestrian walking by. By allowing a T-shaped driveway, a car can turn around safely within their own driveway with no conflicts and come out of their driveway going forward, giving them greater visibility of other bikes, pedestrians, and cars. Then we moved on to specific intersection recommendations. And there is a lot more information on these that can be found in the report. I'm just giving a very high level summary here. At US 206, we discuss proposing redesigning the geometry of that intersection to remove that make that channelized right turn much tighter to slow the rate of speed that a vehicle enters Paul Robeson Place, and to possibly realign Hodge Road and Paul Robeson Place to make it's more of a straight movement going across. At Chambers Street, we have proposed a roundabout and upgraded pedestrian facilities, and that actually greatly improves the operation of that intersection for all users, including vehicles and pedestrians. At Witherspoon Street, we have recommended considering a northbound left turn lane, as well as pairing that with either a lead pedestrian interval or an exclusive ped phase to the traffic signal timing. And while that might normally impact traffic operations slightly, the addition of a northbound left turn lane would help improve that situation, as well as adding a no right turn on red lit sign that could be turned on and off with proper phasing to mitigate changes in delays at that intersection, but that would be a result of adding a lead pedestrian phase or an exclusive ped phase. At Vandeventer Avenue, we have proposed a raised sidewalk or intersection and adding inward signage to improve safety. And at Moore Street, a similar recommendation of a raised crosswalk or intersection, and possibly pairing it with a rectangular rapid flashing beacon to aid in crossing. At Walnut Lane and Chestnut Street, we have recommended tightening some of the curbs to slow some of the turning radiuses, and to possibly relocate the Westminster Choir College entrance a little bit further away from the intersection to reduce conflicts, and to consider a traffic signal at that location, as it does meet some of the warrants. And finally, at Linden Lane, also consider a raised crosswalk or intersection. Moving on to bicycle recommendations, we walked in the report through 4 different recommendations, one which was just keep what you have of the Sharrows, and I'm going to talk about the other 2 that we recommended for further study in the report. And the first one is a standard bike lane, and here is a cross-section schematic of what it could look like. It has the 11-foot drive lane that is recommended to accommodate buses and trucks in the corridor, as well as a 6-foot bike lane on either side to accommodate an on-road bike facility. So you are looking at a roadbed of 34 feet, which is wider than exists in most places on the corridor. But being able to put in this type of cross section does depend on traffic calming to lower the speeds and or the volumes, because with the volumes and speeds that are currently in place, this type of facility should really have an additional buffer between the driving lane and the bike lane. So we need to reduce the speed and reduce the number of vehicles on the road to really meet the guideline for just a standard bike lane. And this just gives some of the specifics on those widths that would be required by providing a 5-foot bike lane. That confluence of the factors of speed and widths and volumes that would result in an LTS 3. If you can widen that bike lane by another 1/2 foot, comfort increases and you drop down to LTS 2 with a 6-foot bike lane, which is what we showed on the previous slide. That gives you an LTS 1, a little bit greater comfort there for users. That would require the removal of all the parking spaces and requires roadway widening. And again, I want to emphasize that the volumes and speeds must first be reduced to allow standard bike lanes. So I want to talk about traffic calming next. And this is important, that what I just said about lowering the speed and or volume in order to meet those criteria to have a standard bike lane. Based on guidance from the NJDOT Complete Streets Design Guide, those sections, the middle section at Wigan Street has too high of a volume to comfortably accommodate a standard bike lane, and the Hamilton Avenue section has too high a speed. So the 85th percentile speed would need to be lowered 1 mile per hour from 31 to 30 to be able to use a standard bike lane, and the volume at Witherspoon, on Wigan Street between Witherspoon and Moore Street would need to be lowered substantially down to 10,000 vehicles per day. Now, the traffic calming measures that we have recommended at the intersection improvements and the corridor wide ones are expected to result in the necessary decreases for the speed and potentially as well for the volumes. And if you cannot meet this standard bike lane thresholds, like I said before, that you would need to have a buffered bike lane, and that adds an additional 1.5 to 3 feet buffer between a bike lane and a travel lane on each side. The other bicycle recommendation that we talked about is a shared use side path. And these are distinctly separate from the roadway to separate pedestrians and bicyclists physically from traffic. They're approximately 10 feet wide. At some narrow pinch points, you could even go down to as little as 8 feet, but the wider the better, usually in the cases for the comfort of having both bicyclists and pedestrians on that shared use side path. And we would recommend warning signs to be provided at intersections to minimize conflicts between vehicles and the users of that side path. And in all cases in a shared use side path, cyclists need to yield to pedestrians. This is just a little bit more more information about the side path, that it would require widening to about 40 feet in the area, and again would require the removal of all the parking spaces. So we just put together a little quick matrix of the comparison of the changes that might need to be made between the two bike alternatives that we have recommended to move forward. And one thing I want to emphasize here is that for alternative 2, which was the standard bike lane, a lot of these costs have not been yet considered in the cost of implementing these. So although curb relocations are required for bike lanes, the cost to do that hasn't been calculated yet because the work hasn't been done to determine what sections that needs to be done. And there are wider and narrower sections that may change where curb relocations and drainage relocations happen. But for pedestrians, the alternative 4 requires cyclists and pedestrians to share the north side of the path. Curb relocations, again, are required on both, but they are not considered yet in the cost for bike lanes. Same with drainage relocations. Street tree removals, there is more of an impact with alternative 4 because of the greater greater widening required for that alternative. Utility pole relocation, again, is required for both alternatives, and it has not been included in the pricing that is given in the report. Both will require greater awareness of turning movement changes and potentially additional signage to assure that cyclists can turn safely. But those turns will be made easier in alternative 2 because they're more visible to cars in the roadway. And finally, delivery and service vehicles. Alternative 2 has the potential to cater to vehicles parking in the bike lane, which can cause a problem if a cyclist comes down the road, but that can be mitigated with proper enforcement and education. So just to wrap up, we recommended that intersection improvements be implemented to slow traffic and minimize conflicts and to improve the comfort for cyclists and pedestrians, and implement some corridor-wide traffic calming improvements and possibly increase the number of parking spaces. And we have put forth 2 different bicycle facility alternatives to be considered by Princeton to enhance the comfort of bicyclists and pedestrians, to be further studied depending on the direction that Princeton decides. Something that could be done as a next step is that a short to mid-term demonstration project could be implemented in a low-cost way with either paint or some temporary bollards or just temporary concrete that could be put in place just to test how drivers react and how bicyclists and pedestrians feel about those changes. And with that, I will open it up to questions or comments.
I'm going to start.
Sorry, I was muted.
ready.
Yeah, Michelle had her hand up first. Go ahead. Sorry.
Okay, I'll start. So I'm pretty baffled as to why the parking recommendations weren't. I mean, when I was in the original meetings with the community, the residents and businesses, the use of the parking spaces was one factor that we really wanted to understand the utilization. Understand there's some numbers there in terms of utilization, but we don't know who is parking. And I don't know why you mentioned that wasn't a main driver, but I thought that it was going to be a main driver. Can you just elaborate exactly on the parking?
Sure. So with parking, we had stakeholder meetings with the businesses as well as the neighborhood. And in those meetings, we understood that the main users of those parking spaces were related to downtown businesses and the university, as well as potentially some students. And so there was not an additional effort to survey or do like a demographic search of the parking population. I don't know, Debbie, if you can give any more input on that.
No, I agree with you, Deanna. Based on the times of day and what we observed, there were some assumptions that they belong to people parking to go downtown or to go to the university.
Right, and the residents as well, supported some of that idea because they advise that those parking spaces are not available typically for the adjacent property owners because they are parked up by other users most of the day.
Okay. Yeah. So the assumption would be, if they're parked up, it might be employee parking, which we can mitigate for that. But if it's customer parking, then that's a situation that we'll also need to address in further conversations. But for tonight's analysis, or just to take advantage of having you here tonight, Debbie, I just want to ask also, with your 2 alternatives, that you're recommending, do either of them allow for both bike lanes and any type of parking? Because it's a little confusing. It says the parking could move from, I think, from the south to the north side, which actually would add parking spaces. But I don't think it allows for the bike lanes as well, or does it? Because I know when you do traffic calming, you can narrow the street. Did you have a scenario in your alternatives that would allow for bike lanes on the street and parking on one side, or was that not one of the alternatives?
Sorry, I was still muted. Right now, I believe that no, that parking is not included. We were trying to minimize the amount of width that we were going to have to expand to. If you need to add another 8 feet for parking either on one side or both sides, that expands it even further. Right now, we have been looking at a 40-foot cross section.
Okay, thank you. Those were my 2 questions. Thanks.
Thank you, Michelle. David, I think you had your hand up.
Yeah, I mean, I was going to ask about that specific question because it was confusing in the verbal report that there seemed to be a suggestion that you could improve the amount of parking on the road, but then in the description of the 2 bike accommodations, I guess I heard that neither one of them permits parking to remain. So I just want to clarify that WSP's position is that we cannot, there's no recommended bicycle accommodation that allows parking to remain in this corridor. Is that a fair representation of your position?
Hi, sorry. Yeah, I'm gonna have to actually look back and double check. I just want to make sure. You know, for alternative 3, which was the 2-way bike lane, we definitely had to remove all the parking spaces. Let's see. I don't believe that anything has any parking spaces if we want to retain that 40-foot maximum right of way.
Yeah, I'll just say I think that's a good idea because I think we don't want to have a big increase in impervious coverage based on both the numbers of trees that would have to come down and the increase in stormwater runoff that would accompany that. Leticia and I have been working with the Permanent Parking Task Force, and we think that there are nearby locations where we can relocate these parking spaces. So I'm not terribly distressed at the idea that that the parking has to go, but I just wanted to make clear, because the last time I read through the report, I thought that the side path was actually being recommended, the shared side path was being recommended partly as a way to retain on-street parking, but I'm glad to hear that's not the case.
Eve?
Thank you. Thanks for that report, Debbie. And I've read it a couple of times, but having you go through it tonight was very helpful. So I have 2 specific questions about alternative 2 and then kind of a general another more general question. So the specific questions, I know you said that given alternative 2, there's no way to put in any barrier at all between the bicyclist and the cars. And that would be true of even, I do not know what they're called, the little poles that stick up. There's no way to put any barrier between the bike lanes? I just want to make sure I understand you, even ones that don't seem to take up horizontal width.
Not without widening incrementally. You know, even if you're just putting the flexible delineator, I think that's the word you're looking for.
Flexible
mean-
delineator on the tip of my tongue.
Like that. I mean, you know, they're thin, but they're not nothing. So, you know, at least you're talking about another 6 inches probably on each side. But typically, if you're going to go with a vertical separator like that, you need to give it, you know, a foot and a half space. So it's not to say that it can't be done, but it keeps widening your road bed.
Right. Okay. That's what I thought, but I just wanted to make sure. And this is another very practical question, then I'll get to my larger question. Again, in alternative 2, there's no way for a car to pull over to the side of the street on the Hamilton Wigan, on the area where there are the bicycle lanes, right? You'd have to turn onto a side street to pull over or into a driveway, because anywhere you went to the side would put you in the bike lane.
Correct. Like if you were trying to pull over to park, you know, you'd be blocking the bike lane. If you're having road trouble and need to pull over a second, pull back out, obviously, there's no vertical separator. It could happen, but you know, if you need to truly pull over, it'd be into a driveway or into a side street, correct?
Okay, all right. Okay, now the larger question. Your alternative 2 seems like, to me, the most practical and feasible of the 2 solutions that you're recommending. But it requires, I know there's a lot of people in the community, and I heard from, I think, all of them today, who are very anxious to, you know, having had the beta bike lanes experiment, which was successful in 2018, and now it's 2.5 years later, very anxious to have this corridor in Hamilton. Getting the speeds down and the traffic down, of course, seems to be the key step. And if, let's say, we were able to pursue that fairly aggressively, do we have a clear set of steps that we would need to take? And do you have any idea either how much time or how much money it would take to get to the point that we could then put in these bicycle lanes? And that may be an impossible question to answer, but even if you had some vague ideas from, you know, 3 months to 2 years, or I think hopefully you understand what I'm trying to get at.
Yeah, I want to be clear that the standard bike lane that we were talking about here requires actually 32 feet, not the 30 feet that are out there, because the travel lane needs to be 11 feet, not 10 feet. So I think that.
Can you talk a little bit more about that? Because my understanding is that the national standards for roadway design allowed a minimum travel lane for this class of roadway at 10 feet. So I'm curious where you're coming up with 11 feet.
It is allowed, but I don't believe it is desired due to the frequency of buses and trucks on that area. And I'll let Deanna chime in on that if she'd like to.
Yes, Debbie's right that it is allowed, but we do need to be cognizant of the truck movements through the corridor. And the goal is to create a safe atmosphere or a safe area for all users, and to make the youngest and oldest cyclist feel comfortable riding on the facility that we would build. And so that's where having the 11-foot lanes for travel, as well as the 6-foot lane for bicyclists, you just get a little bit extra wiggle room, you know, a little extra room to recover from, say, inattention as you're driving. And it provides a level of safety that we want to go above and beyond just nominal safety. We want to have a substantially safe design here.
Eve,
Can I just continue? So given that then we have to widen the roadway so two questions. First is, where does that area come from? Does it come from, I mean, I'm just looking at one of the pictures in the report. In some cases, there's a sidewalk. In other cases, there's, I don't know if you call it a verge between the sidewalk and so where do you get the territory to make the road wider? And if you're going to make the road wider, why can't we make it even a little bit wider than, I mean, if we're going to, it seems, okay, incrementally, if you're going to get 6 inches, and I don't know if you get the 6 inches on one side and 6 inches on another side, I assume you don't do that, because it seems that would be extraordinarily expensive. And if you take a foot on one side, can you not take a few more inches, and then you can get, I already forgot the term for the dividers, the
Flexible
elongate-
delineators.
Say that again.
Flexible delineators.
Flexible delineators. I'm going to write that down. You know, what are, so anyway, if you could talk a little bit about what the trade-offs with that would be, and how, like, where does this territory come from? And
Debbie, I can jump in for you.
Okay, thanks. I'm going to write down flexible delineators so I know that next time.
Yes, so that, I mean, it definitely requires a survey, a visual survey of the built environment out there, and what, you know, identification of what the sacred components are. For example, if we want to avoid relocating utility poles, then you potentially would hold the curb on that side of the road and push all the improvements to the other side of the road. But in some cases, then we may encounter very large happy street trees that we don't want to impact as well. And so oftentimes we find in Princeton, you're threading the needle once you identify these components within the existing streetscape. You just have to fit your improvements within that. But yeah, most likely it would be taking out the verge or pushing over the sidewalk more. And that's, you know, that's where this road may shift from side to side a little bit, depending on what we find. And in terms of cost, I would envision this is like a Witherspoon Street project where it would probably be a couple of phases to make improvements, because you have a roundabout to consider, you have a traffic signal to consider. Those are, you know, probably, you know, in the range of about $1 million together. And then raising your intersections, adding your traffic calming and moving your curb and drainage, you know, those all add to a project cost. And so it would just be fitting in with the priorities of the rest of the municipality in terms of how to execute the project. But we can definitely look at these pilot experiments that Debbie mentioned, in addition to, you know, if there is a consideration of just restriping the road, understanding that it's not creating the level of traffic stress that we ultimately want. That might be an option. We'll have to talk further about that, but we can also look at tightening some of those corner radii that are mentioned in the report as well. So there are a few different things we can pilot for much less money. We can also look at putting in some temporary speed tables or speed reduction, vertical deflections in the roadway as part of a traffic calming program to see, you know, it'll be give us the ability to gather that data as to the volume and speed reductions that might be possible with permanent improvements.
Okay, thank you. Just to follow up, I know that there's really a lot of people that would like this done ASAP, and the more I hear, the more, complicated and maybe nothing is, because so nothing is going to happen on the larger project in the near future. So whatever we can do to have those pilot projects and to allow people to use that road. I mean, I think we can remove the parking in the short term, and whatever can be done to, to put in this temporary speed tables or whatever we can do to slow the traffic enough to get people out and allow them to use this as a biking path while we work out all the rest and do whatever we need to do. I would love to see that if that's possible. So if that can be part of our plan going forward, is do we have a short term, can we do both a short term and a long term plan to achieve this goal of having a bike corridor there? Okay, thank you very much, both of you.
So let me just say, tonight, we're not making any decisions on what we might or might not do. We're just accepting the report. So if we want to do, Eve, some of the things you had just said, I think that's a future council discussion to figure out what direction we're going in. I'm just trying to set for everybody listening, I just want to make it clear that we're not making decisions tonight. So anyway, Mia, I think you had your hand up, and then Michelle.
Yeah, I know there are a lot of people who are here to speak about this, and I'm really interested to hear the opinions of people. I know that the bike committee has spent a lot of time studying this area, and I'm interested to hear what they have to say. But I also, I just wanted to second what Councilwoman Niedergang said, which is, we really would like to, there's a very strong feeling in the community that we need a way for people to be able to bike an east-west corridor particularly for the younger members of our community to be able to get from home to school and to town. And I mean, we have sent people to the moon. We've done some really complicated things. And I just feel like every time I hear about this study, it seems like we've been studying this for years. We keep going back and getting new reports, and we've had a pilot and we've talked about it, and it seems even more complicated than when we started. And at the risk of sounding ridiculous, I just wonder, how complicated can it be to just have a space for our kids to get from one side of town to the other? And everyone's going to have to make some compromises here, but it seems very clear to me from the input that I'm getting that this is absolutely a very strong community priority, and we do need to make it happen. And I still don't quite understand why we haven't been able to figure out what to do, but whatever we need to do to get there, I think we should try to do it soon. So
thank you. Michelle? Michelle, you're still muted.
Sorry.
Okay.
I know we're just going to accept or reject this tonight, and it's kind of done. We did add some things last year to the study, and again, I just go back to, I don't know if there was a way to still have done a survey on that utilization of those parking spaces, because to me, there's like really a key element there. And I did misunderstand. I thought that the shared spaces would allow for parking to be moved to one side or the other. But what I've heard now tonight, the clarification that either would not include parking. So I just throw it out there. I don't know if there's a possibility of still doing that survey. I know we're going to take this now and move to hopefully some committee of some sort, so we can start to work through this with the varying, with the idea of getting something done. There's a lot of good recommendations that are important for traffic calming, safety, and yeah, I mean, I'd love bike lanes too. I just want it all. I want bike lanes and I want parking, and so and I guess everything comes at a cost. So we want to look at that, and I want to try and keep an open mind as to what we're going to do moving forward. But I just throw it out there, if there's anything that we could do to find out more about the parking utilization, before you go away. So anyway, that's my final comment. Thank you.
I had a couple of questions and comments. Deanna or Debbie, do you know that for the majority of that corridor is the outer edge, so to speak, the edge of the sidewalk that's into the yards, is that the same width as the right of way, or is the right of way wider in some areas than sidewalk to sidewalk?
The right of way is wider. It does vary along the corridor. I think our narrowest section is, I think around 46 feet wide. We do not know if this, if the road and the improvements are centered in the right of way or if they are shifted one way or another.
Okay. So part of, as we start to take a more detailed look at this, we actually do have more width than what's there today,
Yes.
hypothetically. I would say that the parking situation, we do need to have some resolution to something with the parking. I don't think we can just magically take away all that parking and hope for the best. So I think we need to address that. And I would think also that if we're going to do something to provide safe biking on that corridor, I really think the biking can't just be on street level. It needs to be raised up like the sidewalks are. So you actually have a curb between where the vehicles are and where the bike traffic is. Because I think it's just, there's too many vehicles on that road. And as much as we can try to do traffic calming, some people respond well to traffic calming and other people just ignore it. So I think the safest thing may be to not have the bike lanes on the street, so to speak, even if you have some flexible barriers or whatever, but a curb might be safer. But something to look at. Are there other council questions or comments so we could let the public start to ask questions?
Mark, I did just want to indicate if there is a desire of council to request that WSP do a survey, a demographic survey of the people that park in the corridor. I understand it's COVID conditions and this may not be the best time to have a true representation, but we do have a little bit of flexibility with the budget that's remaining in the contract.
Okay, it's good to know. Okay, I think we'll open it up to the public. Mark, I think we were going to hear a letter from the Bicycle Advisory Committee first, and then we can start to open up to other members of the public.
That would be Lisa Seriasol.
Trying to find her in the list. Raise your hand, Lisa, if you're out there. Oh, there she goes.
Good evening. Thank you for the opportunity to present this memo from the Pedestrian and Bicycle Advisory Committee. As you might have noted earlier, this study began under our former title, which was Princeton Bicycle Advisory Committee. We are now officially the Pedestrian and Bicycle Advisory Committee and have been always focusing on the safety of both pedestrians and bicyclists in our efforts to advise the council. The memo I'm about to read was voted on yesterday, January 25th, 2021, and passed unanimously. It goes as follows. The Princeton Pedestrian and Bicycle Advisory Committee, known as PBAC, thanks the municipal engineer, Deanna Stockton, for commissioning the 2020 engineering study of the Robeson-Wiggins-Hamilton corridor, as called for in our bicycle mobility plan and the circulation element of Princeton's master plan. We thank WSP for the study. PBAC agrees with many, but not all, recommendations in the report and supports drawing WSP's study to a conclusion. Making the Robeson-Wiggins-Hamilton corridor safer for pedestrians and bicyclists benefits our community in a myriad of ways. It supports Princetonians who live car-free, 13% of households as of the 2010 census. whether by choice or by necessity. Given the proximity of the middle and high schools, more students would travel by foot or by bike on and across the corridor. There would be an increase in adults reaching the central business district by foot or on bike, which in turn would reduce traffic congestion, competition for parking, and CO2 emissions as called for in the Climate Action Plan. To that end, PBAC supports many of the report's recommendations for traffic calming and intersection design and looks forward to working with Ms. Stockton to implement them. With regard to the recommendations for bicycle infrastructure, PBAC does not endorse alternative 4 shared use side paths. Safety on the path would be compromised by the mixing of large numbers of cyclists and pedestrians traveling in 2 directions. Trees would have to be cut down. Obtaining the right-of-way would delay implementation and raise the cost significantly beyond what is already the highest construction cost, $750,000 among the 4 alternatives. Furthermore, PBAC does not endorse further review of alternative 2 bike lanes. Further study is not needed. A pilot, the Beta bike lane, was already done in 2018. It was very successful because it separated pedestrians, bicycles, and cars, which improved safety for all road users. Council accepted in October 2018 a resolution from the then Complete Streets Committee recommending on-street bike lanes. If vehicular travel lanes are kept to 10 feet wide, a solution implemented in many cities and approved under national engineering standards for roadways of this type, such bike lanes could be installed quickly for just $16,000, and they would provide the essential linkage from the new Bike Boulevard loop into the central business district. We support increasing the safety levels along this corridor so that in the future, it may be possible for the bike lanes to evolve from LTS 2 to LTS 1 over time. That is to say, to become comfortable for users of all ages and abilities. PBAC recommends implementing the on-street bike lanes this year in conjunction with a permit parking pilot along and around the corridor. Thank you.
Thank you, Lisa. Mark, do you just want to let the public come in one at a time now that have their hands up?
Can you hear me?
Yes, we can.
Great. Hi, my name is Tina Castillo. I live on Dempsey Avenue. My daughter, who now lives in West Windsor, recently got a new job and has absconded with our car for her commute. I'm very proud of her. But now my house is one of those 13% of Princeton households with 0 cars. I would like to point out that a further 8% of Princeton residents live in a household with 1 or more cars, but they're 10 to 16 years old, meaning old enough to go places by themselves, but too young to drive. So dear council members, 1 in 5 of your constituents need to walk or bike if we want to get somewhere. I should also add that many essential workers ride a bike to work. When we walk in busy places, the town provides a sidewalk so that we can move separately from the cars. This keeps us safe. Thank you. However, bike riders are just as vulnerable when it comes to being hit by a vehicle that weighs several tons. So giving bike riders our own space on the road will vastly improve our safety. We all believe in equal rights, and I believe that equal rights should include the right to arrive at our destination in one piece, whether we drive, walk, or ride a bike. And it is this aspect of mobility justice that ties into the notion of climate justice. Bike riders will be a big part of how Princeton will reduce its carbon emissions from transportation, as called for in our climate action plan. Unlike EV drivers, bike riders also reduce congestion and dangerous crashes. So if you walk, if you bike, if you ride public transit, in my book, you're a climate hero. I call on you to celebrate such heroes by honoring them, by protecting them, by dedicating space for them on our public roads. Let's build bike lanes like the Beta bike lane. No, they're not perfect. Yes, they were exceedingly popular with the users. And we got this from a survey following the Beta bike lane. Also, may I remind you that the carbon clock is ticking. To stay below 1.5 degrees warming, the science calls for emissions reductions of about 8% per year, every year, starting, please, this year. Let's build the bike lanes this spring. Thank you.
Thank you.
Should be able to speak.
Oh, hello?
We can hear you. Go ahead.
Oh, I'm so sorry. I didn't even see the button there. I had something hiding. So hi, everyone. This is Untitled Chapter. I just wanted to make a few comments about my thoughts on this. So I bike down this road fairly often because I live on one side of town and my parents live on the other side of town. And so this is the easiest way to get across town. And I bike with my 9-year-old daughter, and this road is super dangerous. I choose to ride on the road, but she refuses to because she doesn't feel comfortable. And she chooses to ride on the sidewalk, and oftentimes is, facing different pedestrians, and it's challenging for her. But what I ride on the road because I choose to, because I feel like I should, and I have to assert myself because drivers won't kind of respect you if you don't. You have to really kind of ride in the middle of the road. But I do respect drivers and I try to get out of the way, but with the parking, it definitely is challenging. But oftentimes drivers will get really close to me, or they have to swerve and potentially risk head-on collision. So it's not just dangerous for bikers, but it's also dangerous for drivers, and it's dangerous for pedestrians. So I think it's just dangerous all around, and we need to be moving towards a safer option. And I think that we should be moving towards the alternative number 2, having bike lanes on both sides. I think we should have made this happen, a year ago or 2. And this isn't rocket science. I think that, we don't have to really, it's good that we study the options now we have, and now we know it's simple that, we just put in the bike lanes. And I think that we don't need to think about expanding the road. I think that having driving lanes of 10 feet and bike lanes of 5 feet is definitely reasonable. And I don't think that we can look at, other improvements. I think that, traffic calming things are good. The traffic circles a good idea, but I think there's a way to do this in a very affordable way that doesn't, add to the burden of taxpayers. And I understand that people don't want to lose their parking spots in front of their houses, but it's not their parking spots. The spots are the road is the I guess the ownership of the residents of Princeton. It's not theirs. So and I think that for the greater good, we should be putting bike lanes in. I used to live in Denmark where I biked everywhere, and I just assumed that it was always that way. But I later found out that it actually wasn't. Denmark actually was actually fairly auto dominant in the 70s, but they actually made a concerted effort to change that, and it subsequently changed the culture. And I think that that's what we need to do here in Princeton, and I think we need to do it now. So thanks.
Thank you.
Thank you, Zenon.
Hi, can you hear me?
Yes, Alex.
Alex Merchant, Lawrence Drive. I'd really like to stress that Princeton is a biking town. Every day I bike with my son to the daycare at the YWCA on Paul Robeson. I normally pass a restaurant worker in telltale black pants and black shoes on Alexander Street, headed toward Route 1 on a bike. On my way up University Place, I pass a father on a bike with a trailer taking his kid to school. At the corner of University and Nassau, I cross paths with a high schooler on his bike, waiting for the light to change. If you look at the US Census Bureau data for the proportion of residents that primarily bike to work on a map, Princeton stands out as an island. Nowhere between Philadelphia and Jersey City comes anywhere close to Princeton. There are many census block groups in Princeton where 10% of residents bike to work, and one census block group near 20%. And these are not Princeton University areas. And these are also just commute to work numbers. This doesn't factor in other types of trips. A lot of people bike in Princeton. This is not an anomaly. And these high biking levels are despite inadequate infrastructure. Princeton is long overdue to take action to protect cyclists. And I did hear concerns about cyclists on the roadway, but the cyclists are already on the roadway. If you're concerned about our safety, the thing to do is to take action now. It's not to delay this project and make it more complicated than it has to be. If you want to make big infrastructure investments down the line, I think that's a good next step. This proposed painted bike lane is an important first step in giving residents that bike their due. If you've ever driven on a recently repaved road, you know that before the lines are painted, people struggle to stay where they're supposed to be. And once those lines are down, traffic is able to be orderly. Painted bike lanes will help keep cars where they should be and allow people using bikes to have sufficient space to ride with dignity and safety. It's my final comment. Princeton owes it to its young residents biking to your schools, its immigrant workers biking to work in your downtown businesses, and all residents who bike the basic dignity of bike infrastructure on Wiggins, Hamilton, Paul Robeson. The bike infrastructure proposals are the only part of the WSP report where two alternatives are put forward for continued study. Enough studies. Put a painted pilot lane in this spring. Princeton needs to take action without delay. Get the ball rolling now, and then you can improve the bike lane as the entire corridor is reworked. Princeton has an opportunity to be a leader in the state of New Jersey and do what is right by its residents that bike. And the time to do that is now. Thank you.
Thank you.
Hi, I'm Joe Small. I live on Hawthorne and Harrison Street. I just want to answer, I think, some of the questions that Michelle asked about the parking survey. I can tell you about 2 blocks. First of all, I think the eastern side of the corridor is very different from the rest of the corridor. It's predominantly residential. Your study shows that I think something like 17% of the parking spaces are used on the block between Linden and Harrison. So shifting the parking from one side to the other to gain 10 parking spaces when the 9 that are already there are never used seems kind of just action for the sake of action. If you want to take away all the parking, that would seem to be the wise thing to do, but you're going to have to contend with the people whose houses are on Hamilton Avenue in front and now have parking, particularly for their service vehicles. I think it's less important for visitors who can walk, but the plumber, the electrician, the people who need to be there, these are small houses with small driveways, and they may not have room for an additional vehicle that has to park on the street if they have a leak or a blown fuse or whatever the electrician does. So take away the parking, maybe, but shifting it from one side to the other to create more parking seems to be a lot of action with no benefits. Oh, the one other thing I was going to add was the block between Chestnut and Linden. That's almost exclusively used by high school students who drive to school. And you can see when school vacations are there or when the summer comes, there's no parking on that block either. Thank you.
Thank you, Joe.
Thank you, Joe.
Yes, this is Jerry Foster. I had the privilege of reviewing the 3 different levels of a report that came out. And I want to say what a great number of excellent suggestions are in the report. The goal of the report did change over those different versions. The current version is showing a goal of child-friendly, the level of traffic stress 1 for the bike facilities. Previous versions did not show that. Previous versions were actually, the goal was a level of traffic stress 2, the general adult. And while I believe that it's vital at some point to be able to be child-friendly along this route, I wouldn't suggest making the perfect the enemy of the good. And you can get about 60% of the benefit by having level of traffic stress 2, general adult friendly bike lanes, average old bike lanes on the street immediately for very low cost. No widening is necessary. No, all of those things about the 11-foot lanes is something that's a nice to have. It's not a must have. All the things about 5 or 6 feet and flexible delineators, those are all nice to have. Those are not really must haves. In terms of the standards allow a much more basic form of bike lanes, perfectly legal. And that can be done, now. And I think it should be done now. There really isn't a reason to do the other things unless you can do them over time as money permits. You can get everything you need for $16,000 with some paint at the cost of removing parking spaces. Thank you.
Thank you.
You want to unmute, Mandy?
I'm sorry, I didn't know if something
There
went
you
wacky with my computer. Hi, everybody. I'm Mandy Arshan. I am a mom of 3 boys. I'm also on the bike committee. I just wanted to speak to you about sort of the experience of being, I'm sure you all know, but the experience of being the mom of 3 boys who need their independence. And in our house, as you go into middle school, it's sort of like your graduation into independence. You are able to ride your bike into town on its own. And I think that's very common for Princeton. That's one of the reasons we moved to Princeton. And I just hope these bike routes can be made safer for our children. They are, which I tell them all the time, they are very lucky to live in Princeton. 1, they're getting a great education. 2, they have the independence and the opportunity for the independence with safe routes. I just hope that we are able to improve these safe routes so more and more children can continue to ride their bikes to and from school, to and from town. I also, one of the important parts of them riding their bike is the physical and mental health that I think improves greatly with, the kids getting out and getting into, just getting exercise before the day, working out, the jitters. And I just want to be able to encourage our kids to get on these bike lanes every day, not worry about them going to and from school, and continuing to lead a healthy lifestyle. So I hope that council really considers these bike lanes as a priority for the near future. Thank you very much.
Thank you. Okay, I don't believe it. There's anyone else with their hands up at this point.
Don't see anyone else.
Okay, thank you, Mark. All right, is there, Eve?
I just have one quick follow-up question. I guess I don't know if it's so much for Deanna or Debbie or David as the PBAC liaison. Is the solution that many of our residents are suggesting, can that be worse? Assuming we do this, I assume the volume increases in terms of the number of people riding their bikes on Hamilton, Wiggins, Robeson. Do you see this potentially being worse, as in more dangerous than what we have already? Because if it's not worse than what we have already, I don't see a reason not to do it while we wait for other options. But if the dangers will be enhanced because so many more people might be using the bike lanes, then that's a reason for, obviously be a serious drawback. So I'd just like to hear from those of you who are more expert than I am, what your take is on that particular question.
I'll
Unmuted, so yeah.
go. I'll start, and Debbie, maybe you can also support me here. Is it worse? Okay, so your question is whether having bicyclists operating in the roadway currently or on the sidewalk, wherever they're comfortable, if that is more safe than, say, taking away parking and putting in bike lanes.
It was actually the reverse, but
the reverse.
yes, like
Okay.
those, yes.
So studies do show that traffic speeds can rise when friction is removed, and parked cars are considered friction. So there is the possibility that rather than having a decrease in speeds, which has been recommended in the report, that we could see higher speeds. And as Debbie pointed out, we do have sections of roadway that aren't even 30 feet wide. So if you have a curbed roadway, you are supposed to have 5-foot bike lanes. So then that would be pushing your travel lanes to below 10-foot wide. So you don't have room for error necessarily within that space. It worked with the beta bike lane. While it was a short duration. Debbie, do you have more?
I don't have any specific data. My concern would just be that right now, I'm thinking of the less experienced user. Right now, they're on the sidewalk probably. And while that's not great, how much latent demand then goes onto that 5-foot section, and they're not used to a vehicle traveling really right next to them. That's who my concern is for. And I don't have data at my fingertips to refer to, but that's just where I feel that the
they
conflict
can still
would
be on the sidewalk.
True, they could be.
Mm-hmm.
Yeah.
Sure, but
Okay.
there might be some induction to go then on that. They see that facility is for them. They might be drawn to that, and now they're that much closer to a vehicle because that vehicle only has 10-foot lanes, and in some cases, like Deanna pointed out, less than 10 feet. That section of Paul Robeson that's super narrow.
Mia and then David.
It seems like the solution here, because what you're saying is that if the parked cars are removed and there aren't bicyclists there, the field of vision is wider. And so there's the perception of more space. So it seems, to go back to Eve's flexible delineator suggestion, that that really would be the solution here. And I don't know why, I mean, you have to have a painted stripe there to separate the lane from the road. So why could you not have a thin delineator there? I mean, that I have seen that in, I mean, you know, I've seen that in a lot of cities where, you know, it's there's not a lot of space, and it does seem like it's just a thin vertical, you know, sometimes fluorescent colored thing. It would be, to me, that would be the solution.
David?
Yeah, I just wanted to say that I think that even with a slight increase in speed, bicyclists, and I'm not an expert, but having bicyclists have their own real estate and not weaving in and out of parking and riding in the lane with automobiles, I just feel like the trade-off, the increased risk of another mile or 2 an hour for the car speeds versus the decreased risk of having designated roadway space for the different users. It defies my ability to imagine that the extra mile or 2 per hour is going to outweigh the benefit of having, you know, eliminating the current situation, which is awful, basically for drivers and for bicyclists. I mean, you know, I ride this route. It's absolutely panic inducing.
I do not ride this route because I am way too scared.
Leticia. Leticia, you're muted.
Yeah, good thing. Now I know how that happens. So I just wanted to, you know, not for asking for solutions, but I know someone earlier on in the conversation brought up the issue of service vehicles. And I don't know which households have adequate driveways to accommodate service vehicles. But, you know, I want to really understand how we would make accommodations, for example, moving vans. It doesn't happen that often, but if it is on occasion going to be necessary, how that's accommodated. So it's just something that I don't know if it was part of this study as far as determining which households would have adequate driveways and which would need accommodation.
In terms of the temporary parking, I think we would just have to make accommodations for it if there is that need. But then you have the other service vehicles like your landscaping vehicles. You know, we don't want to encourage them to park in a bike lane for an hour. And so those vehicles we would definitely be directing to the side streets to be able to service properties if they're not able to park in a driveway, which typically they're not because it's a truck and a trailer that is being used. So we did not specifically look at individual properties. Again, as I noted in some conversations with the property owners, the parking spaces during the time of the study were not available to the property owners because they were being utilized by business and student. So as the town develops and more of these delivery services and other vehicles come into town, it's something that we are coming against all over the place, especially in downtown areas.
They're all going to be drones in 3 years.
Perfect.
Any more Amazon delivery trucks.
Including the moving vans.
So if we could just circle back, right, because tonight we were going to accept or not this report. So I think we should probably move towards doing that, but we should also move towards what are we doing going forward, because we want to accept the report, I believe. But then we should also maybe set some parameters as, are we going to ask staff to help us develop how to come up with a short-term plan that says maybe there is a way to achieve what is being asked. I should also mention there's 11 emails sitting out there, which I'm not going to read them all because they all basically say the same thing, which is please do something for bike paths on the street right away. But those emails, either those people can, when we come to a meeting, we're actually going to vote on what we're going to do. Either we'll read the emails then, or maybe the people will be able to attend. But since we're not taking definite action tonight, but I think we should accept the report and then just lay out how it is we're going to try to look at a short-term and a long-term solution for this along that corridor. So anyway, that's up to David.
Yeah, so I will move to accept the report. I think there's a lot of good improvements in the report. There are things that I do disagree with, but we don't have to agree with everything to bring it to a conclusion. So I would move to accept the report. And just to answer the second part of your question, I think the next step is to work out the parking relocation. And I just want to emphasize it's not a removal, it's a relocation, at least in my mind. So nobody freak out. People have used the term removal, but I think it's a parking relocation. So the Permit Parking Task Force has already been giving this a lot of thought, and I think we can work out something in the next few months. And I think that while that's happening, that the engineering department, Public Works, PBAC, and traffic safety should be hashing out what should happen in the corridor.
Yeah.
Is there a second first?
Well, I'll second, but I also have a question.
I wanted to ask if it's possible, rather than just accepting the report, if it's possible to accept the report with council in some way indicating that we acknowledge the bike committee's analysis of the report with a preference for option 2.
That's what I was going to say.
Okay.
Yeah.
I don't know, Trishka, legally or how that would work, but I would like to do something more than just accept the report.
My comments are going to be along the same lines. Yeah.
Michelle?
Like,
I'm sorry, 1 second. Dwayne, were you done? I'm sorry.
No, not really. Well, it was along the same lines as what Mia was asking. I'm saying, I'm not exactly sure how we do not accept the report. I mean, it's a pretty comprehensive report. But I was thinking, I kept hearing we're not taking any action tonight, but it seems to be a consensus around alternative 2. And I guess it goes back to Mia's question. It's not I'm not sure. Like, I guess I could defer to Trishka on how we do that. But I number one, I can't see how we do not accept the report. I mean, the report is there and it makes sense. I think the real issue that comes up, so we can actually take some action, so we can start implementing this, is a kind of what alternative we want to lean to, which consensus seems to be alternative 2, which is the recommended alternative. So I'm not sure if that's a question or a comment, but the bottom line is, I think we need to both accept, which, like I said, I can't understand how you do not accept it. But the real question is to figure out what's the consensus of the governing body as far as moving forward, so we can start to implement something.
Right. Okay. So I would just, Michelle, you go ahead. I'll wait. Go ahead.
Well, 2 things. One is I was going to ask if, in accepting this, if Deanna had mentioned before that there might be some flexibility in terms of budget and in terms of doing that parking analysis in a little bit more depth. So I was going to ask you about that. And now Dwayne Councilman Williamson just raised another point, which is, which I would disagree with. I don't think that we should be taking any particular leanings towards anything right now. I think it still needs a lot more work and discussion, but that's my view. But I do want to ask Deanna the question about if we could do any other analysis on that, because that's still, to me, a big gaping hole in this analysis.
I would need to consult with WSP, with Debbie, to identify, well, first we would need to identify what the scope of work is, and then get an estimate of the cost from WSP to see if that fits within the remaining budget on the project. But again, I caution that these are very strange times. We probably have, 3/4 of the population that are working at home. And so I'm not sure that the data that we get would be what you're seeking to help consider the situation.
Right, so let me just go back, David. I just want to make sure that there's a motion right now. So your motion was to accept the report. And so Mia or Dwayne, I believe.
Mia
both of you.
Seconded.
I did second it, right? Yeah.
Okay, yeah, I mean, you kind of beat her to the fact on seconding. So
I
I just wanted
wasn't seconding it. I was asking Trishka, and poor Trishka, we never gave her a chance to answer Dwayne's and my question.
okay, I'm sorry. I was trying to let the council comments finish.
Yeah.
Ms. Trishka, I got it.
I mean, I think you can. I think you can basically frame the motion however you'd like. You would need to modify David's motion, but I don't want to get hung up on parliamentary procedure. I think more to the point, it really sounds like you guys are discussing what sort of direction you might want to go in, and if there's direction that you want to give to staff in terms, or to some of your subcommittees or your BCCs in terms of follow-up now that you have this report. And I think in terms of accepting the report, I think Dwayne makes the right point. It's really, you have a good report, you don't feel the need for further reports. Now you're ready to move, take the next step, whatever direction that happens to be in. So
I would just caution us that I really believe that we put out there that we were going to accept or reject the report, not that we were going to take action. I understand, Mia, what you're suggesting, but I think it's inappropriate for us to say that we're accepting one alternate or another. I think we could safely say we're accepting the report, and we'd like staff to look at an alternate that follows the concept of alternate two, but further develop it. I don't like the idea that we're going to suddenly say, this is the alternate we like, when we did not say that that's the action we were going to take tonight. And I think we need staff to have a little more time to develop what the exact right.
And the reason, and the context for me making that suggestion is that I can't think of an example in which this seems to be a rather unprecedented, that I don't remember us accepting a report. Usually when council accepts a report, it constitutes endorsement. So it seems, I wanted to make clear that we're not accepting the report as with both recommendations being equal, because to me, that's what accepting the report, it has that connotation. And I think it's, usually when we accept something, it then gives the staff, it's basically giving them the leeway to move forward with any of the options. We're basically saying, yes, we accept these recommendations, whatever you think, fine. And I think based on what we've heard tonight, both recommendations are not equal. And I also, I guess, Michelle, I'm wondering, like, do you, the other option seems to be, do we put more money into studying more? And like, are you saying that you think that are you asking them to find more parking within, that's sort of the other question.
Right, sorry. I'm very concerned that I don't feel that the study parameters were completely met, because my understanding was that we were going to have an idea of who was parking on the street there. So I'm not sure, and I know now it's not addressed. certainly don't want to spend more money, but my understanding is that the money that we allocated was not fully spent. So I just.
So it's still spending more money if it wasn't spent, even if it's in the budget. So, and I want to comment just that I think Joe Small's observations about who's parking along the different segments of the corridor, I found very insightful. He's a resident there. He seemed quite confident and knowledgeable about it. I think that information that he offered was probably better than the information we would gather if we did do some additional study at this unusual time, during COVID. So I would consider Mia's idea a friendly amendment, which I would accept. I would not accept Michelle's suggestion that we do more study on the parking as not really worthwhile.
Mark, the chair of the bike committee has just raised her hand, and apparently the parking information she's saying was in an earlier iteration of the report. Could we give her a chance to comment on that? She's raised her hand.
Yeah, that's unusual since we have a motion on the floor. But let me just go to Dwayne and say, Dwayne, are you okay still seconding David's motion that he's willing to change slightly?
Yes, that's
Thank
fine.
you. Okay. All right, council, okay if we go to let the public back in for a comment or two?
Yes.
Okay, Lisa?
Hi again. The earlier mention of the various iterations of this report, there was one in August of 2019. I do not have it in front of me, but it did delve into the parking conditions in more detail than the current study does. And I can certainly dig this up, but probably Deanna has it as well. But what I'd like to underline is what our committee had recommended, which was to work with the permit parking task force to find a solution. And as Deanna has pointed out, and as we all know, the conditions of the economy and the activity in town are not really representative of what at least our old normal was, and who knows what our new normal will be. So as a process to merge into the evolving conditions we live in, I would recommend that the permit parking task force can work, if you want, with other groups, including the Pedestrian and Bicycle Advisory Committee, to resolve this. But I don't really believe that more study at this time would be warranted. As far as parking.
Lisa, thank you for bringing that up, because it may be that August 2019 study is what I remember, because this goes back to 2018, I think, from the very beginning of the study. And I agree. I mean, right now, first of all, I don't want to spend more money, and secondly, I don't think that we're in the right climate to really be able to know. But I just wanted to bring that up if they're, because again, I thought that it was done. So if it's done, then that's great. Thank you.
And the August 2019 report is available on the municipal website for this corridor study.
Thank you, Deanna. Eve, did you have a comment?
I just wanted to piggyback. I had the same thought that David did, that Joe Small's report was very valuable, and maybe we can do just a little survey of other people along that corridor to supplement whatever we have in the August 2019 report. Not everybody will be as good an observer as he is, but there may be anecdotal evidence that we can pick up, given that this is not a good time, even if we wanted to spend the money to do a study like that.
Agreed. Join.
Mary, I'm just trying to get some clarity. Let's say, presuming that we accept this report tonight, what would be the next step? I mean, obviously, Deanna is continuing with more studies, et cetera. Michelle brought up it's still, there's the open question about parking, et cetera, but I'm just trying to figure out, so at a certain point in the future, we're going to expect this to come back and then we pick an alternative?
Well, I think we picked the details of whether it's alternative 2, alternative 2A, or whatever it's going to be. But I think the immediate future is for the permit parking task force to try to outline what they believe is going to be a successful relocation of parking spaces. In the meantime, we could be asking Deanna's World to take a look at the alternate 2 concept and how do we practically put it into play. So right, there's a concern by some that the 10-foot travel paths are too narrow for vehicles. So we're going to have to address that. We should figure out, we should be looking at both the short term and the long term in my mind, because anyway, we should be looking at both and we should ask staff to do that. So we should figure out what is the right of way. Is the roadway centered in the right of way, or where is it in the right of way? But I would hope that we'd be able to also ask staff to look at the other recommendations. It seems we're focusing simply on the bike paths and not the other recommendations in the study. And all the other recommendations, we're not just going to ignore. We need to figure out which ones we're going to do, because that's going to impact what is it we're going to do, both short term and long term. So we could set some time period, working with Deanna, what makes sense to have staff review this and come back to us, whether it's in 3 weeks, 4 weeks, or whatever. But I think we should set some expectation, so where we have a detailed discussion about the recommendations and start to say yes, no, yes, no.
Okay.
That's my thought.
Thanks.
David, you had your hand up, I thought. David, did you have your hand up? I'm sorry.
Yeah, I just wanted to, you're talking about the long term, also jogged my memory of another comment that I wanted to make, which is that, there is a micromobility revolution sort of right around the corner with electric bikes and scooters. And I think that these separated bike lanes, rather than a shared side path, is really the only solution that will prepare us for what's around the corner versus what's the reality today. And we've talked about this a lot in relation to Witherspoon Street. We don't get a chance very often to reimagine our infrastructure in a thorough way. And so I think that we need to be thinking about not just who rides bicycles and walks today, or who will ride bikes and walk in a year from now. We need to be thinking about, multiple mini electric that are going to want to have facilities as well, because that's coming.
Thank you, David. Mia?
Yeah, I'm concerned because since COVID, we have put in the agenda, and I assume we still do, that residents have 2 options. They can either come in person to attend the Zoom meeting, or they can send their comments to Princeton Comments at Gmail, and then we read them. So I don't know if the emails were to council members, but if they were to the Princeton Comments, I don't know. I don't feel totally comfortable just ignoring them, because this has been our policy for during the COVID period. That was how we offered residents the ability to make public comments, and we would read it for them. I just wanted to put, I'm concerned about that.
I share Mia's concern. I wonder if maybe Trishka can weigh in on this, since again, we're not taking formal action. But I agree with Mia, that has been the precedent, that people sending in emails is the same as being here.
And the former mayor used to read them. That was, but if there were emails that were all the same, then, she would just say, here's repeating this, this is a repeat of the same email.
Right. Well, I think it's okay. Well, yeah, I didn't read them, but I alluded to all 11 were basically saying the same thing. So
should we just read one of them then? The same.
Yeah, let me. Yeah.
And it would be also great to mention who the ones were from. You don't have to read it several times, but
Can I just hear Trishka's,
Yes,
sorry,
that would be
Trishka.
very, very helpful.
Could you just give us your quick opinion on that as?
Yes, there are a lot of things on your agenda where you're not obligated legally to take public comment, but if you're going to allow public comment when you're holding a remote meeting, you do have to allow people to submit their comments in writing. And if they do, then those need to be read into the record. However, Councilwoman Sachs is correct. Duplicative comments do not need to be read into the record. You just indicate, who submitted the comment and that it's the same as the preceding comment.
Okay. Here we go. Anna Rothman from Linden Lane. Dear Council, I am in full support of the immediate implementation of alternate 2 standard bicycle lanes on the Hamilton-Wiggins corridor. This could be an inexpensive and quick way to show commitment to improving the movement of families, workers, students of all ages, and tourists through our town. Removing the parking would make it safer for cyclists, and a dedicated travel lane for bicycles makes the sidewalks safer for pedestrians. More residents are walking and biking locally than ever. Instead of getting bogged down in tree removal drama to construct a shared use path that would not meet the needs of cyclists or walkers, choose alternate 2. Best wishes. Sam Bunting, 99 Dempsey Avenue. He had served on the Princeton Pedestrian and Bicycle Advisory Committee and on the Traffic and Transportation Committee. If there's a safer way for people to ride on the streets, we would encourage bike use and make life better for students on their way between school and the town. Also for many hourly workers who use bikes. I support striping bike lanes on Hamilton and Wiggins. Elaine Guerin, I don't think she gives her address. But again, pretty much the same viewpoint. Andrew Thomas of 256 Edgerstone. Yeah, please don't waste yet another chance to improve the lives of Princeton residents. It's time to deliver. Michael Fass, 79 Dempsey. Pretty much the same comment. Erin Hassanoff of, no, I'm sorry, she doesn't give her address. Support of the proposed bike lane on Hamilton Wiggins Robeson corridor. Robert Karp, 45 South Harrison Street, regular bicycle rider. We need lanes, we need bike lanes with blockages so no one can park or deliver standing in the lane. Julie House of Kyler Road, similar comments. Wesley Wilson, similar comments. Randy Rutberg, similar comments. And Jessica Wilson, 720 Hibben McGee Road. Again, similar comments. Those are the emails. All pretty much with the same message. Okay, so we have a motion. It's been seconded. David, do you want to just restate?
Rita, can you just make clear what the exact amendment to the motion was?
Yeah, I was just about to ask him to restate the motion.
Yeah, so my understanding of the motion with the amendment is to accept the report with an express preference for bike facility option number 2.
And can we also add in that an expressed preference and a directive from council to staff to follow up in a timely way, or to prioritize the coordination with the parking permit task force? That's
okay.
When you have an email and it's marked priority with an exclamation point, whatever the amendment equivalent of that is, that's what I'm suggesting. Let's mark it high priority. That's what I'm saying.
We need someone to state exactly what the motion is.
Right.
I mean, is that necessary to be part of
To
it?
accept the report and to express preference for bicycle facility option 2 and request that the permanent parking task force work expeditiously to find a solution for relocating the parking from the corridor between Witherspoon and Harrison, and that staff work expeditiously to work out the details of how to implement option 2 in the short run, or in the short term.
Bravo, David.
Bravo.
Now, again, seconded.
Excellent. I
Okay.
third.
Okay. Questions on the motion? Michelle?
Okay, well, I'm just going to make a comment that I agree with the working expeditiously. I agree that just to accept it and move on. I don't agree with having any particular, alternative preference. I'd rather just say that we were going to work expeditiously. So I will have to abstain if that's the way it's going to move forward.
Any other questions on the motion? Okay, if not, we'll call the motion. Those in favor of the motion, could you just raise your hand so we can be sure we get proper count here? Okay. Dawn, are you able to see the 5 council members that voted yes?
Yes, and I have Michelle down as abstaining.
Well, okay, I was just going to ask her to officially do that. Michelle, you're abstaining as opposed to nay?
Abstain.
Okay,
Because
that's fine. All right, so it's 5-0-1, 5 in favor, no opposed, and 1 abstention. Okay. Well, thank you very much. That concludes that item.
Thank you.
Thank you.
Thank you. Thank you, Deanna. Thank you, Debbie. Okay. Next item on the agenda would be public comments for items that are not on the agenda. Does anyone from the public have a comment for something not on the agenda that they'd like to make? All right, I don't see any, so we'll close that section of the meeting, and we'll move to resolutions. Resolution 2146, resolution authorizing 2021 contract for Child Health Conference providing preventive child health services with Capital Health for a not to exceed amount of $50,000. Is there a motion on that? Michelle makes the motion. Leticia seconds. Questions on the motion? Eve?
I'd just like to thank my colleagues, Councilwoman Perrin Lambros and Councilwoman Fraga, Council President Fraga, for their work on this. Is a great achievement, a great victory for Princeton, having Capital Health open here and taking over this service that is so vital to the needs of many of our residents. So from the bottom of my heart, thank you for that.
Okay.
Well said.
Thank you. I'm sorry. All in favor, say aye.
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 Any opposed? Okay, thank you. Resolution 2147, resolution authorizing a 1-year contract with Central Jersey Waste and Recycling Incorporated for the not to exceed amount of $585,900 for solid and bulky waste collection, removal, and disposal services commencing February 1, 2021. Is there a motion?
I'll move it.
David moves it. Is there a second?
No, second.
Dwayne seconds. Questions on the motion? Eve?
I can't let this go without recording our, discontent with the services that have been provided, and hoping that moving forward, we'll be able to find other companies that are interested in bidding to improve this service. I know the cost of waste disposal is going up, and that's a long-term problem we'll have to answer, but hoping we can find a company that maybe can do a better job for our residents. I just couldn't let that go. So,
Maybe I can add, if I can add something to that, Mayor, to what you
Yes, sir.
said. Yeah, I mean, just so the public knows, apparently, just from reading the council packet, apparently there's just one bidder. And is that what I understand, right?
Yes.
And yeah, so just to add to what you said, I mean, I'm no expert at garbage collection, et cetera, but I'm not exactly sure, how one creates a larger market in that, so we can get more bidders and more competition. But I just wanted to add that. I'm not exactly sure how it works, but when you only get one bidder, that always concerns me.
So I would just throw two things in real quick. If hopefully at some point this year, we figure out a way to maybe get the organic waste program going, because one way to reduce your solid waste cost are to start an organic waste collection program. The other thing is some of the complaints we've had about pickups and things with this vendor, actually in our contract with this vendor, there's a limit on the size of trash containers that they will pick up. And many people have gotten much larger containers that they're putting on the street that have actually violate the contract, violate the union agreement between the contractor and their staff, their employees, and actually have caused a number of injuries to their employees because the containers are so heavy. So anyway, there's always two or three sides to every story. And I'm not saying this to say that they're tremendous, but anyway, we need to look at a number of things to try to make sure the waste collection happens and that we don't have a problem with the only hauler that appears to be interested in working for us at the time. Any other questions or comments? If not, all in favor of the motion, please say aye.
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 Any opposed? Ayes have it. Okay, resolution 2148, authorizing the award of a contract to United Ford LLC, Educational Services Commission of New Jersey, contract ESCNJ 20-2109 for a 2021 Ford Escape hybrid vehicle in the amount of $27,694.53 for the use by the Recreation Department. Is there a motion? Eve? That's a motion, sorry. Eve makes the
I
motion.
have a question too, but a motion first.
Okay, is there a second? Leticia seconds. Eve, your question?
Sorry. So I'm very excited that we're acquiring, I think it's our first hybrid, as far as I know. I'm just wondering if somebody can tell me where will this be charged and what kind of, you just use a normal plug or, and
It may not even be a plug-in hybrid. Prius is a hybrid that charges by driving it.
okay. Got it.
There are hybrids that you plug in, but I don't know if this is one.
David, I believe you're correct. We also have hybrids within our fleet. I believe it's a couple, which are the same ones, which are non-plug-in.
Thank you, Mark. Any other questions on the motion? If not, all in favor, please say aye.
Aye.
Okay, the ayes have it. Moving to the consent agenda.
Excuse me, Mayor. I have one resolution that's not on the agenda.
Yep.
I have to make it verbally because it's time sensitive.
Yes.
Which is, I'd like to move that we reappoint Julie Capazzoli to the planning board. She's been a long-term member of the planning board and was inadvertently left off at the reorganization meeting when we were generally appointing BCC members.
Yep. And David, I was just going to ask if we could add that to the consent agenda, just so the resolution, just so the resolution numbers stay sequential. That's all. Just make it easier on the clerk's office. Because that's
okay with me. If it's okay with Trishka.
Yes, that's fine, as long as it's clear in the minutes and on the record.
That would be resolution 2158 then.
Correct.
Thank you, Dawn. Okay.
And Julie's going to be a full member, correct?
Correct.
Correct. Okay, so everyone's fine with us adding that to the consent agenda?
Well, is there a motion is to add it, or is the motion on it?
To amend the consent.
I think the motion should be to amend the consent agenda to add that resolution.
Okay,
Then,
so I'll second that. I mean, I second both, but so
Okay, so-
David was a motion to add it, so I'm seconding it, right?
Thank
And
you,
then we'll
Dwight.
do the actual motion on the actual
Yes.
thing that was added. I got you.
Yes.
I would like to move the consent agenda with the amendment.
All right, we just need to vote on the addition of that.
Oh, I'm sorry.
resolution to
You're
the
so
consent
right.
agenda.
Right.
Okay, sorry, but thank you. I'm coming right back to you.
You're right.
All in favor of adding that item to the consent agenda, please say yes.
Yes.
Absolutely, yes.
Okay, thank you.
Aye.
Thank you. Eve, do you have a motion?
I do have a motion. Thank you, Mayor. I would like to move the consent agenda with the additional item added by Councilman Cohen.
Thank you. Is there a second on that?
Second.
Okay. Any questions on anything on the consent agenda? If not, all in favor, please say aye.
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 Okay.
Can I just ask, did the clerk get the second on that last motion?
Yes.
Okay, good.
Yeah,
Yes, thank you.
thank you.
Thank you.
It was close though. Mia has it.
All right, there's no other items on the agenda.
Move to adjourn?
Thank you. Is there a second? Seconded by Leticia. All in favor, please say aye.
Aye.
Well, thank you
All
all.
right, good evening, everyone. Take care.
Thank you.
Good
Good
night,
night.
everybody.
Thank you, everyone that tuned in from home.